Guys, so today I am, let me see, 14, 16 days post-op. It's been a little rough. A few days ago, let's see, I'd say about, I'm gonna say about a week. A week into my surgery, I was very swollen. Tuck this in a little. I've mentioned that before, that extra skin there. It still bothers me, but for now, I'm just gonna deal with it, cover it up with my bra. But okay, so back to my thing. So about a week into my surgery, I was very swollen in my abdomen and my back. It was hurting so much. I thought it was normal pain. It was normal because I was a week into out of surgery. So I'm like, okay, maybe this is something I have to cope with. My belly was very swollen. Mainly on one side, I was hurting. So I'm gonna show you my belly and all that stuff. Because I'm actually taking off my tape and everything now, so I can give you guys a real look on the way it's going for me. But yeah, so I went to the doctor and I explained to him, I started my massages. So when I went to the masseuse, she was telling me, lost my train of thought real quick because somebody interrupted me, but it's I think I was talking about how, I know I can rewind the video, but I really don't want to go through that. So yeah, so it was swollen. I went to the doctor. The masseuse told me to go check it out with the doctor because I was very swollen. She was gonna put on my girdle, the what they call a faja. It was super tight. They gave me two extra small. First day I put that on, I wanted to die. I couldn't breathe. I couldn't sleep. I couldn't move. It was horrible due to the swelling. Again, I thought that was normal. So the second day of my massages, I went and she told me, I got there late, so they couldn't do my massages. So she told me, go downstairs and just make sure that everything's okay. And if they have to drain some fluid, then they'll drain it. I go downstairs, and sure enough, they stuck a needle in my stomach, and they drained 3 needleful of fluid. That stuff stinks. It looks disgusting. And it didn't really hurt because I was already swollen, so all it was just they poked a little hole in my stomach and they drained the fluid. Turns out the doctor had to open up a little hole in my stomach in order to completely start draining the fluid. I'll show you, see if it's still a little open, but that didn't hurt because surprisingly enough, what they did was they sprayed some type of anesthetic on it, and he got to cutting. Yeah, just like that. I went for a checkup, and they started cutting. He put an IV, and then he started an antibiotic treatment for me. You might wonder why all the time I have this hat on. I really have no desire to get all perked up, and I have my days where I get dressed up and I'll bring my hair down and all that. But most time, right now it's about 9 o'clock in the morning here. This is there's nothing going on. So this is what I look like. Yeah. So I started to clean up my dressings today. They tell me to do it every 4 days for my tummy and for my arms. The belly button should be done daily. Yes, baby. So this is my belly. It looks yellow because I already started spraying the solution. I put it in a little spray bottle because I think it's easier to for the cleanup and all that. I don't want to just spill it everywhere. They gave me a whole bunch of gauze pads for me to change the dressings. I have the surgical tape, all of that. So pretty much, let's see if I can manage. This is what the pad looks like. That's not blood, not the pad, but the gauze pad. So basically, I spray it and I just dab it so it doesn't, spill all over the place. That's my belly button. Every time I go to the doctor, and mind you, I've seen this doctor every single day. I don't live close by to him. I live about an hour away. If you're going fast, you get there about 45 minutes. In the Dominican Republic, you have to gas up every day. Every time you go somewhere, you have to, buy food, and It's not easy, but I'd rather go every single day. The medications are expensive. Again, I have to do it. So the antibiotics was an everyday treatment. It's funny how he asked me to buy the medication, but every time I go to the clinic, he administers his medication to me. So basically, the one that I bought is just sitting there. Um, so yeah, that's that. But this is the belly button. He says it looks normal and that's how it heals. I've never seen a belly button. I've even Googled it to see. Like I said, I like to make my videos real. So I'll stand up so you can see what it looks like, but I don't know if this is healing properly. I don't know. He says it is. I ask all the, the nurses that help me out and clean my stuff. I asked them to, to tell me if that's how it's supposed to be and everything. And they say yeah. So this is it. And these are my dressings, right? I have not removed these dressings. I'm about to do so. So once I take them all off, I'll give you a glance of that. The hole that he cut was right here. Right now it's a little. I'm sorry that I'm so graphic, guys, but I mean this is what I was looking for when I was doing videos. So I'm sorry. I'll dab it up a little bit so you don't see that nasty stuff. But that's the hole. It's pretty much closing up already. It's closing up already, so you really can't see it, but I'll see if I can post pictures because I did take pictures of all that stuff. I just wasn't in the mood to make videos. I was, I wasn't feeling too good. But my arm so far, this is I started taking off the dressing now, or the tape I should say, and that's what it's starting to look like. I'll pause the video so that I'll come back when all of it is off. I'll be back. So these are my stitches and everything without being cleaned up. When I go to the doctor, they say that it's healing pretty nicely, that it's going to be a smooth recovery, and it's going to look pretty nice. To me, it looks gross. I guess they know what they're talking about. I don't know. So I'm going to get to cleaning. Alright, so that's how it looks once you clean everything up. I'm going to dress it up now. We do a body shot. The swelling went down significantly. I don't have that, I actually don't have pain anymore. Everything went down. This was really swollen. It's really low. And I'll show you once I dress it all up. Alright, so this is how it looks all dressed up. My little work of art. Right here. So they say I have to use this for about 3 months. The tape and stuff. Right now I wear like yoga pants. I find these are comfortable. I can't help looking at myself in the mirror every time I pass by. My mom has a big mirror every time you walk in. So I just happen to just look at myself. See this little extra skin? Again, it's not something that I'm happy about, but I'll deal with it for now. I did speak to the surgeon about the extra skin right here on my, I want to point it out, but I can't hold the phone and do that at the same time. But he said he would start some laser treatments next week. I have to see him Monday. I leave the Dominican Republic on Thursday, so I don't know how laser works. I don't know how those treatments are. I was told that it's a few treatments that have to be done in order to correct any issues or whatever the procedure is. I'm gonna ask on Monday to see how that works out, but I'll of course keep you guys posted. Thanks for watching my videos. Subscribe, like, and share. Take care.